and the public might get some idea of what has been negotiated on their behalf without their knowledge? State into the record who you are and what your role is at the HSA. We're looking at the Auditor General's report where he talked about the Health City deal that was negotiated. And I'm wondering if you have any concerns about the agreement and what effect it could have on the standards of the medical profession in the country, part of which I know is your role to maintain at the HSA.
And currently, as the medical director for the Health Services Authority, I have some role in ensuring that the best care is given to the citizens of the Cayman Islands. Currently, I have spent a number of, recently I've spent a number of months looking at medical tourism in the Cayman Islands against the background of medical tourism worldwide. I've recently had the opportunity to travel to a number of different countries where I've looked at medical tourism in Thailand, Hong Kong, Singapore, New Zealand, Australia, Estonia, a number of different countries, with the view to see what's happening in the Cayman Islands against that backdrop, the greater international backdrop. And so, against that background, I would say I've had some concerns about the current arrangement with the current Health City arrangement. The development of medical tourism within any country has with it several advantages, but then there are several potential negatives associated with it. For example, the exclusivity of the arrangement that is outlined in the contract gives cause for concern. It does decrease the likelihood of the country engaging any other potential provider. And that really is something that one needs to take seriously. Because if for any reason down the road, there is a potential for us to get a high-powered, any tertiary high-powered facility, our hands are tied for a number of years with respect to that.
You were not the CMO when the deal was negotiated?
I was not, no. When the deal was negotiated, I had acted on and off along with Dr. Gerald Smith as the Chief Medical Officer, but Dr. Smith was the Chief Medical Officer at the time.
Are you aware if the CMO in particular, who has a more global role in the standards and availability of healthcare than you as medical director would have, was consulted during the negotiation of this agreement?
I am aware that he was not consulted. I asked him and he said he was not.
In fact, if a Caymanian was to avail themselves to the promised training by Health City, they could not work in the wider community even after they got their qualifications there because they could only be licensed to that institution.
That is correct. What we're noticing is that because of some issues surrounding the agreement and an inability to deliver some of that which was agreed, probably based on the fact that there were overstatement of benefits, probably some information that was not available, and so it was the information that was available at the time was impure. Because of that, we've had to be constantly moving the mileposts, and what was supposed to be a medical tourism facility is now a facility that is competing like a local facility. And so what is happening is that some of the local physicians who have not benefited from these concessions have had to be competing unfairly with a facility that benefited